everybody. My name is Soumya Mandava, and welcome to the What the Health podcast, brought to you by the Alumni Association in conjunction with the Renaissance School of Medicine. Each episode, we bring on an outstanding alumnus who tells us what the health we can expect after graduating from medical school. From their journey to their interests to incorporating it into their chosen fields, we get to hear it all. So, let's jump right in. Hi everyone, and welcome to our new episode of What the Health. Today, our co-host is...
Hi, my name is Mit, and I'm a first-year medical student.
And today we have the distinct pleasure of talking with Dr. Pan and Dr. Sandel, graduates of the class of 1992. How are you both doing today?
Doing great, thank you.
Thanks. We are so happy to have you today.
So the extra exciting part about getting to talk with Dr. Pan and Dr. Sandel is that they actually met during medical school. They were in the same class and they got married.
We're married to each other, yeah. And our story actually started at Stony Brook, our first day of medical school, because that's where we met. And I don't think, to be very frank, looking back, it wasn't love at first sight. So I have to say one of the lessons is first impressions are not always the ones that count.
Well, I wouldn't have said that. I would have said it was love at first sight. No, I'm just kidding. We, our sort of story was sort of an unusual story in that we sort of didn't couples match. We ended up being in the same city, but I still think we have a lot of insights about life. I think about life after. It's sort of finding a balance in the after, I think, is really important.
Just to touch on the earlier side of that, what advice would you give to someone who's trying to balance a relationship where one or both of the partners are in the training portion of their medical career, whether that be medical school, residency, fellowship, or so on?
Yeah, and also I think having a relationship during medical school, on top of juggling all the workload and then learning to be clinical, balancing that with your personal life, that's challenging as well. And I think definitely, I think it's important, since we are in medical school, to really focus on the work, make time for kind of personal, so that you're not completely immersed and kind of getting burnt out, that type of thing. But at the end of the day, unless you're really firmly committed to each other, I think in terms of matching, you have to do what you feel is right, for you at that point.
I think one of the things that is important, though, is if you're in a relationship, right, you really have to, it really should be a we, because we actually didn't for parts of this. And the strain and the busyness of a residency is such that you really have to do your best to at least be close to each other, to live with each other. And it's hard. And the other thing I think is really interesting and important is that I wouldn't, say that two residents both want to be two people want to be internal medicine residents. I don't know that it would be important or even important, would say, to be in the same program, right? Because there's good and bad. The good is that it puts less of a strain on the program if you're in different programs, right? Because your wants do not coincide in time. Two people wanting something is much harder than one.
One of the things that you mentioned that I really liked is how you have to make decisions as a we when you're looking at two people who are in a relationship. Were there conversations that you both were having, maybe during residency, earlier, later, about trying to plan different life events, marriage, kids, careers, moving, buying a house, things like that?
Oh, sure.
During that time when we were in medical school, or even when we were in residency, so we matched kind of by chance. We both ended up in Rochester, New York. So we were together. We were in separate programs, which worked out because there was a little bit of distance. If we went on vacation, it wasn't like two people were out at the same time. And then in terms of planning, Uh,
I think that the big thing was that Cynthia had done was doing a fellowship in Boston, and I think that's when the real we started at that point, and that's when you start thinking about balance. And one of the things that I think about is that, especially when it comes to children, one of the things that has, I think, been a great part of our balance has been that, Cynthia is very, I work as an ER doctor. I have a little bit more control over my schedule, and I'm a little less hard charging than my wife is. And so, you end up being and we end up, I think, both being good parents, and we found a great balance together. It's a little harder, I think, if you're both very hard charging people, to find that balance of time. We were actually lucky. We had, our first at the age of 36. But what's interesting is, looking around, there were a lot of people who couldn't have children who were my age. Right? People started having difficulty. We were very fortunate. That, I think, is going to be a really big decision, right, for all the couples. Right? How do I find a balance, and how do I be a good parent at the same time? If I had it over again, I think that having children a little bit earlier might have made more sense, mostly because we just might not have been so lucky.
Yeah. And also, looking back, I mean, for the fears that we had, having kids didn't really end up cramping our lifestyle, because as soon as we have two boys, as soon as our first baby boy was 6 months old, we were up and skiing, and, we went somewhere in the Niagaras, and we took a helicopter ride, and he was on it. So I would say, for people who feel like kids would cramp your style, if you have the will to do something, you're going to do it with or without them. So I wouldn't be scared of that, looking back.
So one question that I had is, what are some of the interesting dynamics that come with, being together with another physician?
I think it's great to be married to a physician, especially if you're in separate specialties. Like Darrell's in emergency medicine. I'm more hospital-based, geriatrics and palliative medicine. We kind of see each other's worlds, and we completely understand each other's worlds. But it's not like we have a fight or conflict of interest, and we teach each other. We can share, our tough cases with each other. And if your spouse is a physician, they completely understand what you're dealing with, right? But if your spouse is another career field, they might not even really understand what you're talking about. So it's really a great opportunity to just vent and be able to listen to each other.
I think what you're asking for, is what are some of the pitfalls, though, right? One of the things that I found is that you have to sort of accept being where you think you want to be now, right? What residency you want to do, that might be wrong, right? But the general idea of where you want to be is the kind of that choice that you're thinking about early is sort of, I think, sometimes what you end up doing. So what am I saying? I'm sort of the equivalent, I think, of sort of a country doctor in a way. I was a blue collar kid. All I ever wanted to do was take care of patients, and I remember saying that I wanted to be in a foxhole. That's what I wanted, and I wanted to have meaningful interactions with my patients, and to be put on the front lines and be tested. And can I tell them what you said, Cynthia, right? Which Cynthia said she wanted to be the Surgeon General. And she meant it in a way. Like she didn't mean that she was just going to do that, but she had these other aspirations. And one of the things that's interesting is I have come to peace with sort of what I want. And I've realized that what I want now broadly is exactly what I have. And then I have to be happy with that. And actually during COVID, right, there was this moment where I was willing to die, and actually, I'm a heavy guy. I'm in my 50s. I expected that I might die. Okay. And that was the moment when I said, and there's no place I'd rather be, right? I wanted to be right here, right now. There was just no place else I'd rather be than here in this moment. And that really gave me just this tremendous sense of peace about where you are. That's what's really important, right? Is just doing what'll make you happy on the day to day.
Yeah, I think just knowing yourself a little bit and what makes you tick. I do agree there can be, times when you might compare and you might be jealous of each other. Oh, he's doing this. How come I'm not doing that? Or vice versa.
Yeah, that seems like a natural part of a relationship where two people may be having really similar professions, but you can hear from the way that you guys support one another how committed you are to your relationship, and I think that's really amazing. Can I ask how you extend that balance and commitment into the responsibilities that you have at work and distinguishing those from the responsibilities that you carry in your home lives?
If you look at the trajectory of both of our lives, there were certainly times for compromise. For instance, Cynthia was on an academic track, and at some point, having children was really, we had children, and being able to be there as much as possible as they were growing up was really important. And Cynthia ended up doing sort of frontline hospice work. She was a hospice medical director, and sort of changed her career for family, and learned a lot along the way. And I think found it very rewarding. And then as the kids got a little bit older and our time was less important, she sort of phased back in.
Yeah, at least the academic places that I was at, first Mount Sinai, and now NYP Queen, they really want like 200% of you. I try to cut back to like 4 days a week with my chairman. And after maybe a couple months, he told me, you're losing your presence, even though I was there like 12 hours a day when I was there 4 days a week. And he goes, this has become like a job, not a career. I was so pissed off. And I just felt like it wasn't really tenable. I tried to arrange for help. So we hired a full-time nanny so that the nanny can be there because our schedules are so tough. Darrell has scheduled shifts all over the place and my days are long. So I think having a living person to help is a good idea. To ask for help wherever you can find it. And then when I went into the hospice position, which is not an academic position, that actually turned out to be some of my most rewarding years, doing home visits and finding out what can be done outside of the hospitals and meeting some of my most memorable, interesting patients. That I'm actually writing a book about that right now because I just, learned so much from them. So I think that whatever, road you take, there are always opportunities and you can always make the best of it and you can always go back.
Yep.
The other thing, I think that was a really important thing. So we had about the issue of having some help at home, and it wasn't help at home to replace us. Because I think that together, I used to say that we made a mommy or a daddy, right? That we were probably our balance of time with our children was equal to a 1950s traditional family, right? Where the father's out working and he's never home, right? We sort of found this balance in between where we would, our children, I think, lost nothing, right? Because I guess as the man, right, I was willing to sort of take on some, more of a role at home, right? And the way I see my life, that was a privilege, right? And I'm very happy with that decision.
You're like the super dad. You spend a lot more time with the kids than many dads do, I think.
Right.
So our kids are very fortunate. Yeah.
I think you both described really beautifully, like, how you can find compromises and balances between your work, being at home, being together. There's so many different choices that you made, but you guys both sound like such amazing parents. You gave a lot of advice, like, since we've been talking. Is there any other last tidbit that you want to share?
I think one piece of advice, when the kids were young, I enrolled one of my sons in preschool. And they had a thing where they have parent groups once a week where you had to attend. That was like a condition of attending that school. And at first I kind of had an attitude about it, like, I don't have the time for this. But after going consistently, I thought that was one of the best things. It was a real gem. And most places don't give you that. But parenting, is one of the most important things that you have to do in life, on important jobs for which you get zero training, right? So I think that if there's an opportunity when you have kids to enroll in a school program that has parent support and counseling, that's a really great thing to do.
And the other thing I relating to sort of the nanny, what that allowed me was I don't have to worry. I had somebody that I trusted to help. Now, that not everybody's going to do that, but I think that that's important. I think that you need to have some time for yourself.
Thank you so much, Dr. Pan and Dr. Sandel. This has been one of the most unique interviews that we've gotten to do so far, and it's been such a pleasure to talk with both of you. We really, really appreciate your time. Thanks for tuning in to the What the Health podcast. Please be sure to check out our linked resources at the Stony Brook Medicine YouTube channel. See you next time.